first question, have you been aware of any GIST diagnoses in your area since you started this process?
So I do work with our sarcoma lead, but I'm not. I haven't been made aware by our sarcoma lead of what GIST diagnoses have been made. There haven't been any in my practice that I've been aware of. And we review all new cancer diagnoses. But as it came up on the video, it amounts to, was it 600 or 800 patients per year diagnosed with a GIST tumour across the UK. So I think the important thing from the primary care perspective is to take note of symptoms that your colleague was just describing, the setup of the RDS service, Rapid Diagnostic Service, that is gradually being piloted around the country. So it started off in a few pilots sort of around up in the north of England, and it's sort of spread around. We're shortly to launch in Gloucestershire one for patients who have non-specific symptoms. So one of them could be sort of dyspepsia or sort of indigestion, but an immense fatigue or weight loss, itching. There's a host of non-specific symptoms that on investigation they didn't really come to any point to any particular diagnosis. So I've got a patient at the moment who I'm sure is unwell with something serious, and is, sorry, that's my terrier behind me. You can come and say hello to the audience there, and then you can go away. Okay, he just wants to look out of the window. So she's got weight loss. She's really fatigued. She's losing weight month by month, and all the investigations have just come that I've got access to have come back negative, and I've got nowhere to send this lady other than to do separate sort of rheumatology and a urology pathway that I'm referring her into at the hospital. So I think, as I said at the start in my introduction, the main message I want to get across to primary care is to make note of of the vague symptoms, the non-specific symptoms, and patients need to not feel that they don't want to bother us with a bit of tiredness or a bit of weight loss. They might put it down to just having an upset tummy for a bit or something like that. But yes, I think these services that are coming through are very exciting, and as ever, everything takes time in the NHS, unfortunately.
Okay, so has anyone got any questions for Dr. Haque? Oh, there's a lady there.
I'm very newly sort of diagnosed. Very briefly, I presented on the 12th of November last year with blood in my stool. I'd had an upset tummy for most of last year, the weight loss, from the end of October, extreme fatigue. Being an ex-ME sufferer of some 25 years standing, I knew it was a completely different type of fatigue to the ME. In addition, I now realise my night sweats are probably not menopausal, but connected to my 7-centimetre GIST, and also the itching again. So very non-specific symptoms. I was sent for a colonoscopy on the 4th of December. My question is, I didn't actually get a call to go ahead for the CT scan until the 4th of February. So there was a 2-month delay between the colonoscopy and the CT scan. Fortuitously, my lump, which I've named Larry, decided, having made one appearance, and its first appearance on the 23rd of January, I wake up feeling that I'd slept strangely and had something sort of digging into my ribs. I then realised it was a lump and kind of like pushed it down out from under my rib cage, and then it disappeared. It reappeared on the morning of my CT scan and obviously showed up very, very nicely for the CT scan. Is that normal, having been referred to the cancer pathway on the 12th of November, to have such a large gap between the colonoscopy, which was clear, by the way, and the CT scan, which obviously has picked up the GIST.
I'm very sorry. Firstly, what is your name?
Sorry, Samantha.
Samantha, I'm really very sorry to read of your very newly diagnosed tumour, and absolutely you describing all the symptoms that we need to be mindful of, and I'm glad that you went to seek help for those symptoms. With regards to the date of the colonoscopy, so there are national cancer waiting times targets that need to take place. Now, I'm not sure. I'm sure you're aware that COVID has really heavily impacted,
Yes.
and the recovery from COVID has impacted the services. However, I was on the understanding that cancer services had been protected, particularly cancer surgery, all through the pandemic. From the primary care perspective, I'd imagine that if you had blood in your stool, that they would have sent you on what we call a 2-week wait lower gastrointestinal pathway for a colonoscopy. And therein the internal surgeons would have arranged a CT scan. I wouldn't imagine at that point that it was something that would have been organised by the GP. What's happening now is there are various both hospitals and primary care have identified the role of patient navigators, and they're busy employing them in various parts of the system to support people like yourselves with queries that are along the journey that they haven't completed yet, and they're still undergoing investigations. So I would say that there's a target to which the RDS service will be working to is a diagnosis of cancer or a cancer exclusion within 28 days. The colonoscopy that you would have had, it sounds like it would have met the 14-day referral from GP to seen by consultant or investigation at the hospital. That would have been covered in the 14-day. Yeah. And then there's 62 days whereby patients need, from the point of referral from the GP to actually starting cancer treatment, that needs to happen within 62 days. So it sounds like your delay is still on the pathway to a diagnosis, which falls well short of the 28 days. And I would suggest it really depends on the MDT, so the multidisciplinary team that would have discussed the next plan. I'm just supposing, from what I know of the processes that happen in secondary care following a referral from yourselves, that it's always a good idea if you do get involved in the hospital to ask if you have a CNS, a clinical nurse specialist, if there isn't a patient navigator at that particular point in time, to be able to address the queries and somebody that you can follow up. And I always do persuade my patients to contact consultant secretaries to ask questions, because you'd get an answer just as quickly as I would, and I have to dictate a letter, etc. So do keep on at the system and don't just keep following up but realizing that they're pressured for whatever reason, that CT scan was delayed, and I can't say any more, I think, but I hope that was slightly helpful, Samantha.
It is. Thank you very much indeed.
Any other questions? Oh, there are a few.
Just to add to that, we have a tagline, which is "You are not alone." You've just described exactly what I went through in 2010, almost including the size of the tumour. And so, yeah, you are not alone. I know exactly what you went through. So bear that in mind, that there are people out there that can share the experience.
Hello, Sadaf. My name's Fiona. I was actually diagnosed 8 years ago now. So I'm my question to you is in terms of living with GIST and the follow-up care we might expect or ask our GP about. I had to have a Whipple's procedure in 2014, so I've only got half a pancreas, and this means I have to take Creon to help digest my food. And I've often wondered whether, you mentioned in the video about the surgeon that was on there about long-term effects of nutrition, and I've never really known whether I should be taking a supplement, whether I should be regularly getting tested for diabetes, whether I should be looking out for B vitamin deficiencies. All of these are a bit mysterious to me, and it'd be nice to know if I could go to the GP a bit better informed about what I could ask for, maybe to be checked, say on an annual basis. Obviously at the hospital, they check your LFTs and your UNEs and stuff like that, your blood counts and bone work for calcium and that sort of thing. But I'm talking about the more, blood sugars and B vitamins, that sort of thing, nutritional things to look out for.
Yeah. Fiona, thank you very much for sharing your journey with us. I think we mentioned on the video the cancer care, the end of treatment summaries that are starting to come out from the hospital. So this is very much to improve the communication between the hospital and primary care, because we know some cancers like GIST, we see them, most people, most of my GP colleagues would not have heard of GIST, which is why we did the video to highlight awareness and raise awareness of it. But also the questions that you've asked us, that you would propose wanting to ask us, are questions that I feel better informed to be able to help somebody like yourself. But again, sort of my jobbing GP colleagues who don't do the extra cancer work that I do wouldn't really know. And so we're very reliant on hospital information. So your cancer, what you mentioned was 8 years ago. So I'd like to think that as these end of treatment summaries come out, you should be having an annual, what we call a cancer care review by your GP practice. And if you're not aware that you've had one, you need to ask for one. So that's something that you could ask your practice for, a cancer care review appointment. And the aim of that is to discuss, whether you've just finished cancer treatment or whether you're some years down the line. It's your opportunity to discuss whatever you want to with your GP or with your practice nurse. So it's something that is our nurse colleagues are being upskilled about. So when I say GP, it may not be your GP, because the primary care is reorganized because of the workload and the immense, the sort of, this is all started even before COVID. So various members of the primary care team are being upskilled and trained. So I personally have run practice nurse cancer training sessions to be able to enable my nurse colleagues to run these cancer care reviews. So in the ideal world, there would be a holistic needs assessment which would have been carried out at the hospital. So if I may sort of fast forward you to, you've just finished your cancer treatment, a year ago or 6 months ago, then there would have been a holistic needs assessment carried out in the hospital and a care plan. And then that would translate into, once the hospital write to us, they finished your treatment, they will advise you of follow-up. We receive the same documentation in this end of treatment summary as you would receive, in terms of a patient held record that can go with you everywhere. And it's all the details of your cancer treatment, all the side effects you would expect, any longer term effects, what aspects of your care needs have already been addressed, what aspects are still identified as ongoing, particularly psychological support needs, financial needs, work needs, all of this. It's a very large document, and a lot of thought goes into those documents. But if I take you back now to where you are personally, Fiona, absolutely, we are very happy to do annual blood tests. And I think if you've, particularly if you've had a Whipple's procedure, the test for diabetes, HbA1c, is a very standard blood test, together with the LFTs and vitamin B, 12 folic acid, ferritin, which is your iron storage, if you're anemic. Those are all standard tests that you would be able to ask for. I think I can only speak for my own practice. I would not have any problem at all, and I would probably have you on an annual recall as a long-term condition, really. So it just depends on how the GP practice has coded your case and your notes. So having a GIST tumour, it's resected, you're all in a sense cured, I would ask and suggest it, but you'll still have cancer, a long-term condition. It just depends on how the practice have coded as to whether you are picked up in the annual recalls. But I hope that is helpful for you to talk to your practice about and seeing if you can access these tests, and perhaps a cancer care review, I think is very important.
Yeah, thank you.
Does that help?
Yeah, that does help, because sometimes it's just knowing what you need to go and ask for, and knowing that
Absolutely.
That's a reasonable request. So thank you.
Yeah, very.
I think that's really difficult in how you articulate what you need to get through the barrier that is our receptionists, is often quite difficult. And that's what I mentioned earlier on about the health inequalities work that I'm doing, is there are people that just can't articulate what they need, and that is a big barrier to coming to us. But I would still urge you to keep knocking on the doors, and I do hope that information is helpful.
Okay, do we have any other questions? Oh, there are a couple. Okay, right.
Just to add to that, we've also got some resource at the back here that helps you with nutrition as well. So,
hi, I'm Angela. It's a very quick question. You mentioned earlier about rapid diagnosis centres. I just wanted to know what the lead time was for these centres and where they would be within the United Kingdom, and also whether GPs would have signposting information.
So everywhere is very different. May I ask which area you come from, Angela?
Herefordshire.
Herefordshire.
Yeah.
Okay, so that's just north of Gloucestershire. I'm afraid that is a different. So the way it works is these are being run by cancer alliances, and there are you in Herefordshire, you would be in the West Midlands Cancer Alliance, I would have thought. I'm afraid I don't know about where they are with that, but you could contact. There will be a patient and public person in each cancer alliance to support these sort of queries. So if I just mention about Gloucestershire, so we have we've been planning this for about a year, and we have only just recruited to the final 2 GPs that will be running that service, and one has just started this week. So we're hoping the service is going to launch, but it has been over a year in planning. So it's something that is coming, and in certain areas, I think London have been very forward and advanced, and there are rapid diagnostic centres set up. The idea is that they are close to home, so you don't have to travel. But with geographies that are disparate as the southwest, there's lots of travelling involved. So what they've done is they've set up centres that still require you to go into the main hospital, because you can't have a CT scanner locally. That there's a lot of work that the NHS is doing about getting diagnostics closer to the patient. But I think the main thing is to be informed about these. You may not have heard about rapid diagnostic centres before your colleague mentioned it. So I think that is a really important first step, is to know what you need to know more about, and to find out what is available in your area.
The actual principle of rapid diagnostic centres has been knocking around for 6 or 7 years, and it's been piloted in the north. But as Sadaf said earlier, obviously things do move quite slowly. And I have been asking for some while now, so okay, when are we going to get one in the West Country, and where is it going to be? And it's a question I asked Nick recently, because obviously he's attended a few Cancer 52 meetings where we're discussing this. It would be really helpful, I think, if we could get a list for the whole country about where these things are, even if it's you know, an incomplete list at the moment. At least we know where they are. So it is one thing that's on our agenda to do.
Yeah, I think the phrase that the NHS are trying to get their eggs all in a basket at the moment, in a row, ducks in a row, whatever the phrase is. So it's coming. You know, the COVID again. I know it sounds like an excuse, but it's been a reason why maybe it's been delayed. If it wasn't for COVID, maybe by now we would. The answer to that question would be more precise. Okay. But yeah, we are working on it. Well,
so
one more question.
Got one more question, and then hopefully we can move on to the next, because there's another bit video, patient stories next. If you're interested to see those, of course, yes, because it would be the whole thing then for the GPs, and obviously we've got to fit in Andy before lunch. So last question.
Hello, my name's Jenny. Hi, can you hear me? My name's Jenny.
Yes.
Firstly, I'd like to say I had wonderful diagnostic support and immediate follow-up from my GP when I first started having these weird and wonderful symptoms. Unfortunately, that GP has now moved on, and I feel a bit disconnected from my practice because I haven't been in person for years, and my care is managed by the hospital. But really, I'm curious to know what you as a GP think that I as a patient, and perhaps others of us here, could do to educate our GPs. What's the best way of us getting through to them? Because I know how busy GPs are, and you don't have time, to have meetings with patients, but there must be a way that we could help with this education campaign.
Thank you very much, Jenny, for that question, and delighted that the idea is that we create a community of influence, and I love this idea that we sort of, it's train the trainer, go out and take the story with you and take the benefits of what can be the education with you. So key people that you could contact. So each practice have got a patient participation group, and I would probably suggest they are the people to contact in the first instance, because they will meet regularly with at least one of the GP partners. Again, the setup, because GP practices are run so differently, I can only say what I know mostly of in Gloucestershire and what happens in my own practice. So I know that one of the partners meets regularly with our patient participation groups. We, as clinicians in our practice, we have a half day of education every month at the moment, or every 2 months. And we have clinical teaching as well. So there's protective time for the GPs to get involved in education, as well as what's going on. So part of my wider cancer role, not as a GP, is to do a lot of GP education for the GPs in Gloucestershire. So I would suggest they would probably be the best port of call. You can also email in the practice, so they would normally have a generic practice email, and I'm sorry to read, but I hear it a lot about a lot of people being disconnected, particularly when they've been very heavily involved with the hospital looking after them, which is why we have been sort of banging on about this for quite a long time, is having these end of treatment summaries so that patients don't feel they've fallen off a cliff by ending their hospital episode and then coming back to primary care and feeling that primary care really don't know much about them, don't know much about the detail of what they've been through, and how they can be supported going forward. So those are two ways. I would always, you can email in generically. It's usually an admin at whatever practice name there is, but if you contact the practice or look on the website of your practice, that will tell you, and you can just ping in a proper one email with a link to say that you're really passionate about raising awareness about the cancer that you've experienced, with educating not just the GPs. If you make it sort of the whole of the primary care team need to know really about it, but we're starting with GPs as the main clinicians, because you've got to start somewhere.
Just to add to that, Yeah, thank you. So just to add to that, these type of patient meetings help us as a charity feed back these type of things through the channels that we have through back to the NHS. So all of this sort of stuff is important for us to listen to as well. Thank you.